We're talking about the Psychiatric Intake Response Center, also known as the PIRC, here at Children's of Alabama. And I'm joined by Cindy Jones, director of the PIRC. Cindy, thanks so much for your time.
Thanks for having me.
So let's talk first about what the PIRC is. What purpose does it serve?
Sure. So this is a free confidential service we offer here at Children's of Alabama. So any adult can give us a call that has a mental health concern for their child, and we can give them some direction as to what the next steps are, and we help match them with mental health resources in their community.
So when a parent calls, what should they expect?
So what they can expect when they call is really an opportunity to speak with one of our licensed mental health professionals who is going to do a brief online assessment, and they're going to ask questions like, what is the age of the child? Where do they live? What's the presenting concern? What insurance do they have? And that way they can access our database. They can say, okay, based on those things in your county, in the community you live in, these are the providers that say they can offer services to you. And so I think that's really helpful to those that are calling, because a lot of times they have no idea what resources are in their community, and we're always adding and updating our database to make sure we have the most up-to-date information.
And they understand all the ins and outs of the mental health system and whether or not it's an emergency or whether they need to set up an appointment with a provider.
Yeah, exactly. Because a lot of times people call and they really don't know what they need to do. So that's part of the service we offer, is just being able to identify what it is that really you need. And many people don't know if it's a psychiatrist, or if they need to go to the emergency department, or that their child needs therapy. We give them some options and we talk to them and educate them on that process.
And I know the PIRC has been around for a few years now. How has it grown or changed or evolved over the last few years?
Sure. I think probably it's because we continue to be in a mental health crisis, and we've had the opportunity to be able to help more people identify and get access to the care that is out there. And so we're really proud to be able to help people in something that can be really difficult or challenging to navigate.
And you serve the entire state of Alabama
We
and
do.
even beyond?
Yeah. Statewide
Right.
mostly, and we have identified resources in all 67 counties, and we have identified some that are in the southeast.
How effective would you say the PIRC has been at providing these resources and helping kids who might really be struggling?
I think probably because they can talk to a clinician on the telephone. Oftentimes, if you call a private practice, you're going to be speaking to a non-clinical person who's just there to schedule appointment. We offer education. We offer an opportunity for that person to just process what's going on, ask questions, and then understand clearly what the next steps are.
I guess in a lot of cases that it can be sort of calming to talk to someone like that on the other end.
I think so. I think we do help alleviate some anxiety, some frustration, maybe fear that the caller might have.
So if a parent has any of these types of questions, how do they get in contact with the PIRC?
Sure. So all they need to do is give us a call. Our number is 205-638-7472.
All right, once again, Cindy Jones, director of the PIRC, the Psychiatric Intake Response Center here at Children's of Alabama. For more information, go to childrensal.org.